Assalamu alaikum. Today in this video lecture, I will be explaining the anatomical snub box and the clinical importance of the anatomical snub box, right? So first of all, I'm going to introduce that what exactly the anatomical snub box is. The anatomical snub box is actually a triangular depression that is present at the posterior lateral aspect of the hand, right? As you can see in this very picture, this is indicating the posterior aspect of the hand, and this highlighted portion that I have highlighted with the black color, actually, this very triangular depression is actually indicating the anatomical snub box, right? So anatomical snub box is an inverted triangular depression that is present at the posterior lateral aspect of the wrist and the first metacarpal, right? This black region is indicating the anatomical snub box, right? I have also highlighted the anatomical snub box in my hand. As you can see, this black region, as you can see, this is indicating the anatomical snub box, right? And the anatomical snub box is present at the posterior lateral aspect of the wrist and the first metacarpal, right? So the base of the anatomical snub box lies in the wrist. This is the base of the anatomical snub box, and the apex is this pointed region. As you can see, this is present at the posterior aspect of the first metacarpal. This is the first metacarpal, and this is the apex of the anatomical snub box, right? So this was all regarding the location of the anatomical snub box, right? Now, this is the medial aspect of the hand that I have highlighted, and this is the lateral aspect of the hand, right? Now, let's talk about the floor of the anatomical snub box, that what structures are actually forming the floor of the anatomical snub box, right? So the floor is basically formed by three bones, actually. One we have the scaphoid, and the second one we have the trapezium, and the third we have the first metacarpal, right? So let me write it. So the base is actually formed by, first of all, I'm talking about the base. So the base is formed by three bones. Number first, we have the scaphoid. The second one, we have the trapezium. And the third one, we have the first metacarpal, right? The third one, we have the first metacarpal. So the scaphoid, trapezium, and the first metacarpal are forming the base of the anatomical snub box, right? Now, there are the boundaries of the anatomical snub box. There are two boundaries of the anatomical snub box. One we have the medial boundary, and one we have the lateral boundary, right? So the medial boundary is formed by one muscle, and that is we have the extensor pollicis longus muscle, right? So the medial boundary is formed by a muscle, and this very muscle, this is actually the tendon of the muscle, and this very muscle is called the extensor pollicis longus muscle. So this is, we have the extensor pollicis longus muscle, the extensor pollicis longus. This is actually the tendon of the extensor pollicis longus muscle, right? And similarly, the lateral aspect is formed by two other tendons, right? The medial aspect is formed by just one tendon, and that is the tendon of the extensor pollicis longus. Now, the lateral aspect of the anatomical snub box is formed by two tendons, and these tendons are the tendon of the extensor pollicis brevis muscle and the tendon of the tendon of the abductor pollicis longus muscle, right? So one, we have the tendon of the extensor pollicis brevis muscle, extensor pollicis brevis. And now, lateral to the tendon of the extensor pollicis brevis muscle, we have another tendon, and that very tendon is the tendon of the abductor pollicis longus muscle. Now we have another tendon, and this very tendon is the tendon of the abductor pollicis longus muscle. The abductor pollicis longus muscle, right? Now, there are some contents or some structures that are passing through the anatomical snuff box, right? And there are three contents actually that are basically containing in the anatomical snuff box, and these are the radial artery and the cephalic vein, and the third one we have the radial nerve actually, right? So now I'm going to draw the contents of the anatomical snuff box. Let me draw the anatomical snuff box here. So let's suppose that this is the anatomical snuff box. The first structure that I'm going to draw is the radial artery, right? And the radial artery is passing oblique to the anatomical snuff box. As you can see, the radial artery is actually passing oblique to the anatomical snuff box. So this very structure is indicating the radial artery. Radial artery. Now we have a vein in the anatomical snuff box. That very vein is called the cephalic vein, right? So let's consider that this structure is the cephalic vein. This structure is the cephalic vein. And the cephalic vein is basically originated from the dorsal venous network, the dorsal venous network of the hand actually. Let me draw the dorsal venous network. So let's suppose that this is the dorsal venous network, and from the lateral aspect of the dorsal venous network, the cephalic vein is originated. This is the cephalic vein. And this is the dorsal venous network. Another vein is also actually originating from the dorsal venous network, and that very vein is on the medial aspect, and that very vein is called the basalic vein. But we are not dealing with the basalic vein right now, because I am talking about the anatomical snuff box, and in the anatomical snuff box we have just the cephalic vein, right? Because the cephalic vein lies at the lateral aspect actually, right? So this was all regarding the cephalic vein. And now we have a nerve, and that is passing through the anatomical snuff box, and that very nerve is actually the superficial branch of the radial nerve actually, right? So let's suppose that this is the superficial branch of the radial nerve. This very structure is the superficial branch of the radial nerve. So far I have discussed the three contents of the anatomical snuff box. One, we have the cephalic vein. The other one is the superficial branch of the radial nerve. And the third one, we have the radial artery, right? So these are all the contents of the anatomical snuff box, right? Now let me tell you an interesting point regarding the anatomical snuff box, that what is the relation of this depression with the snuff box? Why this is called a snuff box, right? So let me tell you a story, right? So this is called the snuff box because in the ancient time, people used to put the powder snuff in the anatomical snuff box, right? And this very depression actually, and then they used to inhale it, right? So from this very concept, this very depression is being named the anatomical snuff box, right? So you should remember this story regarding the anatomical snuff box, right? Okay. And now the roof of the anatomical snuff box is found by two structures. One, we have the superficial fascia and the skin, right? So regarding the roof, you should remember that the roof of the anatomical snuff box is found by the superficial fascia And the second one, we have the skin. So this was all regarding the anatomical snuff box. Now let me explain some clinical scenarios that are concerned with the anatomical snuff box, right? So basically, a doctor can detect two things from the anatomical snuff box. One is the fracture of the scaphoid bone. One is what? The fracture of the scaphoid bone. Now I am talking about the clinical scenarios actually. One is the palpation of the scaphoid bone actually. One is the palpation of the scaphoid bone. In the ulnar deviation, if you will bend your hand towards the ulna side, so somewhere here we have the ulna, right? If I bend my hand towards the ulna, so this is the ulnar deviation. And now, in the ulnar deviation, you can actually peel the scaphoid bone, right? So if there is any fracture in the scaphoid bone, so the surgeon will actually, what the surgeon will do, the surgeon will actually palpate the scaphoid bone in the patient, right? So at the anatomical snuff box, you can basically palpate the scaphoid bone for any fracture, not only the scaphoid bone, but the trapezium bone and as well as the first metacarple you can detect in the anatomical snuff box also, right? And the second clinical importance is that in the contents I have talked about the radial artery actually, right? So a physician can palpate the pulse of the radial artery in the anatomical snuff box also, right? So the second clinical importance is the radial pulse. So the physician can actually feel the radial pulse by putting his fingers at the anatomical snuff box of the patient, right? So this was all regarding the anatomical snuff box. I will meet you in the next video. Take care of yourself. Bye bye. Allah Hafiz.